righty. So it is 5:30. Chair Bethman, if you would like to get us started.
Sure. Well, good evening. Thank you all for being here. My name is Kathy Bettman. I am former city council member in Clearwater, but no longer. Good afternoon. Commissioner Faith Sanders, glad to have you here. Glad that you're all here. So I serve as chair of the Continuum of Care. I've been on this board for 4 years and enjoy the work. And it's a continuous learning curve as well. I'll introduce the people that are up here, and then if we could take just a minute, because there are so few of us here tonight, you could just say who you are, and then we'll move through the agenda. So sitting here at the corner of the dais is Victoria Kelly, and she is, what's your title with the HLA?
I have no way to remember it. I'm the Senior Manager of Organizational Advancement and Strategy. And $1 for anybody who can give me that title at the end of the meeting. Yeah.
Go ahead, Pamela.
Pamela Wolf, I am the Secretary of the Homeless Leadership Alliance. Good afternoon, everybody. My name is Daisy Correa, and I'm the new CEO at the Homeless Leadership Alliance.
Hi, good evening, everyone. I'm Kevin Marone. I'm the president and CEO for Bowley Centers. We are a provider here in Pinellas County, and I am the chair of the Providers Council.
Hello, everybody. It's Mick Constantino. I'm the new chair for the HLA following Tom Brady. Pamela Falls.
Well, good evening, everyone. I'm Michael Lundy. I am the president and CEO of the St. Petersburg Housing Authority. Well, the St. Petersburg Housing Authority.
And thank you to everyone who's joined online as well. We're happy to have everyone here tonight. So this is the second of 4 general membership meetings that we'll have through the year. We have them quarterly and touch on different aspects of the COC and people that are interested in joining, as well as people who are members. And Commissioner Faith Sanders is the vice chair.
Good evening, everyone. Deborah Big Sanders, Vice Chair, CLC, as well as the Chair of St. Petersburg City Council.
All right. So as we start, great, we've got the agenda. There we go, for the same one, so we're good. I can see. I wanted to take a minute and say thank you to St. Petersburg Housing Authority for hosting us today, and Mr. Michael Lundy, can you share some information about your facility here, what you do?
Oh, absolutely. Would you rather me stand or sit?
Whatever's easiest.
Okay. Well, good afternoon, and I just want to officially welcome you to the St. Petersburg Housing Authority. We're proud to be able to host this meeting this evening. I want to take a moment to introduce my chair of the board, Mr. James Dates. And thank you, Chair Dates, for being with us. He's a very, very strong supporter of all the supportive service here in Pinellas County. So we're really happy to have him here. I know you're expecting Danielle Thomas, and you would rather have Danielle Thomas, but you got me this evening. She sends her regrets, and she apologizes that she's unable to be here this evening, but we hope to see her soon. So I'm sort of filling in for her. And I was asked to take a few minutes just to talk to you about St. Petersburg Housing Authority. And so I'd like to begin with just a few what we call fun facts. All right, so the St. Petersburg Housing Authority is a quasi-governmental agency. In other words, we receive our federal funds, funding from the federal government, Department of Housing and Urban Development. The enacting legislation is from the state, and we serve the local jurisdiction, which is the city of St. Petersburg, and we can serve within 10 miles outside of the city limits in either direction. Now, there's a little caveat to that. If we have a nearby housing authority, which we do. And we have the Pinellas County Housing Authority, then there's some funky rules you have to follow in order to be able to purchase property within that 10-mile radius. Just want to share that with you. We are we were formed in 1937. So we've been around for 87 years. We're not going anywhere. We're gonna always be affordable. And we're not here to, flip units to the private market. We're here to provide affordable housing for the good citizens of St. Petersburg. We are, the oversight entity is our board of commissioners, 7 appointed board members by the appointing authority, which is the mayor of St. Petersburg. We are the second oldest in
Housing, have you done anything with them?
oldest housing authority is Jacksonville. And we are the largest affordable housing provider in St. Petersburg. We serve over 4,000 families. We have 457 hard units that we manage and operate with subsidy stage with the units. So when people come and apply, we charge them rent based on their ability to pay, 30% adjusted income. When they move out, was the subsidy stage with the units. So we have about 457 hard units and different categories. We have affordable, we have public housing, and then we also have project-based vouchers for hard units as well. We have 3,600 vouchers, and we have the ability and capacity to perhaps fund 38. We don't have all the funding for 3,800, but we have funding for 3,600. And we have a variety of vouchers. So we have vouchers that are PIN-based, where a person can take the voucher and it's flexible, you can go anywhere you want, within the county, within the city, it's portable, you can leave the state, you can stay within the 48 contiguous states. And so that's why people love vouchers, because they're like gold once you get them, and the subsidy goes with the participant. Whereas in the public housing program, the subsidy stays with the units. So it makes it very, very flexible. We have specialty vouchers as well. So we have tenant-based, and then we have some mainstream vouchers, which is for, I think it's the disabled elderly, but disabled working people. We have the emergency housing vouchers, which are to help people who are in critical housing need and may be homeless. And we're working with the Homeless Leadership Alliance to actually facilitate those vouchers. I think we have 79 of those. We have foster care vouchers for young people aging out of foster care. So that's a very important program. We like to do something, down the road, we're going to do something special for some of these special vouchers. We also have bad vouchers. This is for families who are veterans. These are veterans who are in need of assistance. We partner with the Veterans Administration, VA. They provide the supportive services. We provide vouchers, and we administer vouchers. I told you earlier that we have 457 hard units, but we have a fair block, which means that we can go up to 757 hard units that we, according to our contract with HUD, that we can actually add more units. And so that's what we're in the business of adding more units to what we have now around. What else can I share with you? Although our primary mission is to provide permanent housing, we really have a robust social service department, and we provide wraparound services. And for me, that's kind of the lifeblood of what we do, because it's more than just the bricks and mortar, but how can you get people beyond public housing as we know it? And so we have two programs that are, our signature program. One is our family self-sufficiency program, is where we have our participants, the residents, work with case managers, professional social workers. And they come up with a case management plan over 5 years, pretty much what we do in our own personal lives. We have a plan to where we want to be next year, where we want to be 2 years down the road. And in the plan, you have specific steps. You know, if you're trying to improve your debt, then you, your credit score, then you know what you have to do is pay off the bills, that sort of thing. So we have a case manager who's working with all of our participants. And that program is incentivized. So as they work through that program, we're able to create an escrow account for these family members. So oftentimes, when they graduate in 5 years, we may cut a check for $10,000, $12,000, because you can use it as down payment for new home, for education, purchases, that sort of thing. That's one program. The other program is our home ownership. This is one I really love. I love both. But the home ownership program, it really helps to break that cycle of generational poverty, generational public housing. Because you can actually take the voucher, which is based on your ability to pay. So if I'm a participant and I have a voucher and I can only, and let's say the rent is $1,500 a month, I can only afford to pay $500. The housing authority through the subsidy program, through housing choice voucher program, will pay the $1,000, right? It makes it affordable. Well, think about that for a moment. And if you convert that and have that same scenario for home ownership, this is what our home ownership program is. Once you participate in the program, you get the counseling, you go to the classes, all of that, then you get to a point where you can convert that voucher to home ownership. So instead of paying the full freight of maybe $2,000 a month for a mortgage, maybe you're paying, $7,000, and then the housing authority is paying the remainder. And we do that for like a 15-year period. What happens is that theoretically, over 50 years, if you're working, that's one of the criteria. If you're working, then you systematically, you're gonna earn more. When you earn more, then you pay a little more of your income, and we pay less. So theoretically, in 15 years, we're out of mortgage. But then you become homeowner, you go to the cycle, you've got some equity, it's a beautiful thing. So I get off of that. And I will also just share with you, we think a robust real estate development program. And what we're trying to do is bring new hard units into the community. And this is where I understand Victoria is going to assist me. Thank you. So if you look on the screen, so everybody knows about Jordan Park. If you've been in the city any time, you know about Jordan Park. And this is the photos here are photos pre-redevelopment. It was like 2020, something like that. The next slide is, well, in January 2022, we did our groundbreaking, and if you notice, we're all wearing masks, right? And it was during COVID-19, and think about it, how tough it was in terms of illnesses, in terms of labor shortages during COVID. Also, when you think about COVID, the supply chain that way, and so this was January 2022, and I believe October 2023. All right, we delivered those units in less than 2 years. Right, so we were able to meet the schedule. and actually beat the schedule. I attended just about every one of those, meetings that they have with, when they have all the subcontractor meetings. And everybody stayed on point, we worked together as a team, we were able to get it done. So this is the aerial shot of the construction and progress, and this is the aerial shot of the legacy at Jordan Park, which is our senior building, which has 60 units, 3-story, state-of-the-art property. We did some demolition of some existing units, and we built this building here, area shot, next slide. And so these are two, there's a shot of the family units and a shot of the legacy at George Park. In October 2023 is when we delivered the legacy at George Park to the community. And also we celebrate the we're intended for George Park family units as well. So we're excited, it's 206 family units, 60 senior units. And within a couple months, we had all the units ready. All the units ready. So it's 100% occupied. Next slide. So this is just another shot of George Park, family units, and we the number of buildings, 26 units. We've got the appliances, washer and dryer. The city was so gracious to give us money through the CRA funding. I think it was $2 million. And we bought washers and dryers, and we did a lot of other things. But that's one of the things that one of the council members said, we want washers and dryers for the residents. We give them washers and dryers. We give them community balconies for people who have expressed to us during our community meeting that they were concerned about being able to socialize with, especially the seniors, be able to socialize with the neighbors in the older units, in the original unit. Everybody had little stoops. They can sit out and that kind of thing. And so we're going to the senior building, we're not going to be able to do that. It's going to do London. And so we came up with this community balcony concept. So we have community balcony on the second and the third floor, and then the community patio on the first floor. So they can gather out there, a lot of meeting room spaces there. We have pickleball court, walking trail. It's a state-of-the-art senior buildings, beautiful. We have all of whether it's the legacy or Jordan Park family units. We have the hurricane impact windows installed. There's security lights. We have cameras that we've installed, speed humps, all of that. Next. The next redevelopment initiative, which is it's on the way down in terms of we're out of the planning stage. We're ready to break ground. Is our Ed White Hospital that we purchased back in December of 2021. And it's going to be a mixed use development, which has our administrative offices located on the first floor. One of the charges I was given when I came here was to move us closer and make us more connected with the people we serve. Because if you came here today, you know how difficult it is to get here. And it's tough. If you find it, you can find it, on the GPS, if you can find it. And if you ride the bus, well, you can just forget it, right? So we realize we have a problem. It's a beautiful building, but it's a problem because we're not connected. And so that was one of the charges when I first came on board. So we found this property, we identified this property, 121,000 square feet. We have administrative offices on the first floor. We'll be right there on site. We're going to have 71 senior units, 1 bedroom, 2 bedrooms. And we'll be there to manage those units, to service the residents. And the third component is commercial space, about 2,000 square feet of commercial space that we are leasing out to Ibarra Health Care Clinic. it's going to be providing healthcare services to our residents and to the larger community. So we're very excited about it. We've got it all funding in place. We intend to break ground in August. We still, one thing about being a positive governmental entity, we got a lot of hoops we got to jump over and a lot of boxes you got to check. So we are, in the process of getting everything finalized so that we can go to closing. Once we go to closing, we know that we will be able to, go in the ground and come out in that 18 months, 2 years. And on my left, you'll see the current, rendition of the building, and then on the right, you'll see the projected, look. And so it's going to be quite impressive. Next slide. And so, we always got to have something, we always got to be doing something, right? Because we get bored. So we have to try to find a new project. We got this huge unmet affordable housing need that we're trying to fill. So we're here for a purpose. And we've partnered with Blue Sky Development, and we have a property that's located on 32nd Avenue North. It's about a little over an acre, and this is the concept of the units we're going to build there, which would be about 95 units. We also have another property that's adjacent to this land. It's called Saratoga, which has 34 units. We've already gotten some money through a grant, TD Bank grant, to replace the windows and the roofs. And we are, soon we'll be looking to finance the renovation kitchens and baths. And is that it?
Thank you so much. You've got a lot of exciting things going on. It takes real fun for everything to see. But it's not enough, but it's never enough,
That's right. Yeah.
Which is why we're here.
We do, I'll say this, I'm not saying it because the chair is in the room, but we have a great board. And it wouldn't be possible without the support of the board. Now, I've been around some boards that weren't so good. And it's hard to get things done. When you have friction on boards, here, good leadership.
Well, thank you. And thank you for allowing us to meet here tonight, for being a partner. We really appreciate it. All right, so Victoria, we have that agenda up there. So today's meeting, what we're going to do is we're going to talk about what the COC is and why we do the work that we do. What our Homeless Leadership Alliance, our lead agency, does, what their role is, as well as we're going to start back up with the state of homelessness in Pinellas County to give you some pretty stark facts, which I think, a lot of you are service providers, you're probably pretty much aware of the dire situation that we're in. But we've got some up-to-date numbers that we're going to share with you. So thank you, Mr. Lundy, and I'm going to turn it over now to Kevin Marone, who is president and CEO of Foley Centers, and he also sits on our Continual Care Executive Committee. And Kevin's going to go through some of these stats that'll be part of the presentation.
All right, good evening, everyone. And so I'm also the chair of the Providers Council, so I thought I'd take a moment, since there are providers in the room or that may or may not be involved in the Providers Council. It is, our role is to really help understand the needs in the community and help drive some of the systems and programs. So if you're not actively involved in participating in the Providers Council, I encourage you to get involved. We need all perspectives in helping us achieve some of the lofty goals that we have. We meet, our next meeting will be May 2nd. That meeting will be a joint meeting between the providers and the Funders Council. Two of our we have 6 meetings a year, and 2 of them our joint meetings with our funders so that we can work collaboratively with them to come up with the best initiatives to drive our programs and services. So I wanted to just start off with those few comments before we roll into the state of homelessness in Pinellas County. So we're going to walk through some data that based on some reports that what is the state of homelessness in Florida, as well as here locally in Pinellas County in the Tampa Bay area. There are two main reports that we'll be walking through that give us this information. And yes, there's a lot of acronyms up here, so I'm gonna go through the acronyms too, starting with HUD, Department of Housing and Urban Development. So HUD has an annual homeless assessment report, the AHAR, that is released every year after the point in time is done, and the PIT, the point in time, is done every January across the country, and that takes data from those surveys and estimates homelessness in the U.S. Based upon all of that aggregate information. And it kind of analyzes and compares data from different areas and identifies trends both locally and nationally. The second report we'll be walking through is the National Low Income Housing Coalition. That acronym, it's probably easier to actually say the word than it is that acronym, but the NLIHC, but that's their gap report. And so what this does is it breaks down the availability of affordable housing across the US, comparing the housing costs with incomes in those areas. So we're going to start with the AHAR, and there's a bunch of that data up here. But this is the state of Florida, and it's looking at estimates of homelessness. So as you can see, starting at the top right, there were 22,925 individuals across the state of Florida experiencing homelessness. 7,831 were families with children, and 1,213 unaccompanied homeless youth. Again, these are estimates, so these are not, these are our best numbers based upon that point in time survey. There are of course barriers to that survey. You can't always capture everything, but these are the best estimates that we have to kind of drive and direct our funding and services. There were 2,558 veterans, and then 5,979 of the individuals identified here were deemed to be chronically homeless, which according to HUD's definition, we're talking about lengthy homelessness, a year or more cumulatively over the past 3 years. So someone has been homeless multiple times, and that time accumulates to a year or more. Is what we're talking about with chronic homelessness. So 14 in every 10,000 people were experiencing sheltered homelessness, according to the AHAR report. And so that's split right now for almost 50-50 between sheltered and unsheltered. Unsheltered is those people that we identify that were living in the streets, places not meant for human habitation, like bars and places without running electricity and proper living spaces. And then we'll flip to the next slide where I can talk about some of the trends and changes. So the 2023 point in time count, this is last year, found that Florida is home to about 5% of people are experiencing homelessness in the state of Florida. 6% are unsheltered homeless, and 7% of veterans are experiencing homelessness in the entire state. The next part's a little interesting on the trend side. So despite the fact that since 2007, between 2007 and 23, we actually had a 36% decrease in homelessness, which is the largest decrease there is. We are seeing a trend in the last year, 2022 to 23, where we have the third largest increase in overall homelessness, 18.5%. And the fourth largest increase with family homelessness at 21.6%. So what that's saying is, although since 2007, we've seen this trend downward, now recently in recent times, we're now seeing this uptick again. which, might not surprise some people in the room, given, what we've gone through in the last 3 years with the global pandemic and the rising costs of housing and, the declining overall health that we've seen in our state. Next slide. Okay, we're gonna go through some slides that look very similar like this. What they're really basically outlining is it's comparing, it's really showing where the St. Pete Clearwater area fits in relationship to other communities similar to us in size. So the top left box is major cities like New York, Los Angeles, Seattle, San Diego, and it's actually ranking those major cities in these different categories. St. Petersburg Clearwater fits into the other largely urban COCs, which is, basically we're not suburban or rural, but we're not a major city. We're kind of the next largest city. And this first slide is looking at the numbers of people experiencing homelessness. So this is all people that are homelessness. And St. Petersburg Clearwater is ranking 5th among other largely urban cities. So it's pretty high. So we're all through these next 5 slides, you'll see our area is ranking in the top 3, 4, or 5 of the other largely urban COCs. So this first slide is for all numbers of people homelessness. It's a little confusing here, but so this is total numbers, is everyone, families, individuals, everyone. The next slide is just looking at individuals. Adults by themselves, not connected. And we are also the 5th highest in this other largely urban COC for those numbers of individuals experiencing homelessness. And then next, we're looking at families. You'll see we jumped the ranking here to number 2. We are the 2nd highest, and my eyes really can't read this other than 506. I think St. Paul is at 581, so we're not too far from that. So, and this fits with some of the conversations that we have at Providers Council and other areas where we are seeing this problem with families experiencing homelessness on the rise. Next slide. This next slide is veterans. So we are the number 1 for veterans in this other largely urban COCs by nearly 100 people. So hence some of our investments here in this area in veterans through BASH vouchers and other areas. This is a trend we've seen for a while. We have 2 major VA hospitals in our area, very good hospitals. So that of course brings a lot of veterans to our area, and this data is important in helping to drive the difficult decisions that we have to make with, as we all know, very limited resources. And the next one, I think this is our final one, and this one's looking at chronic homelessness. So this is now taking all of those homeless people and then those that have, like the definition I mentioned earlier, that have been homeless for a year or more, and our area ranks the 4th highest in other largely urban COCs for chronic homelessness. Okay, we're going to shift now to the GAP report, which is looking at rental home affordability and availability for every 100 renters. This particular map is looking at extremely low income renters by state. So as you can see up there, Florida is red amongst some of our other states like Texas, California, Washington, Oregon. So we are one of the highest, which means that I think it is 30 or fewer. Pretty good. Remember, it's 30 or fewer per 100. So that means for every 100 homes, there's only 30 or less in these states that are available for extremely low income households. There's some other slides following this that help to provide some better clarity around that. First off, really definitions around these things, extremely low, very low. So here we're looking at area median income, another acronym, AMI, you'll hear used around a lot, AMI. That is area median income. And this is calculated annually by HUD, so these numbers change every year, and they drive a lot of our voucher programs and different housing programs that qualify people based upon these buckets. The graph below it is looking at the Tampa, St. Petersburg, Clearwater area, and that the median family income in our area is $92,000 per year. And then the next section breaks things by extremely low, very low, and low. So that's 80%, low is 80% of AMI, very low is 50% of AMI, and extremely low is 20% of AMI. That's 20%, 50%, 80% of the $92,000. So if you're looking at a one-person household, extremely low is $20,100 per year income. For very low, that would be $33,450, and for low, that would be $53,500. So these are, and then as there's additional members in the household go up, those numbers escalate. So when we look at the state of Florida and we look at the affordable and available homes per 100 renters in each of these income categories, you know, at or below 100% area median income, it's an 89, which means there's 89 available places to rent and live for every 100. So that means even at the under 100%, there's still 11 people struggling to find somewhere to live. Is that a good explanation? Try to put this in easy terms. It's not always easy language to understand. As we move to the next one, which is go back. The 80%. So now we're at 80% AMI, so lower income. Now you're at drop down to 69. So that for people that are making 80% area income, there are now only 69 units of housing available for every 100 people. So now you're talking 31 people that do not have available affordable housing for them based on their income. And then as we move down, it gets unfortunately the story gets worse as we move down, as you might expect. 50%, we're talking 35. And then you get to extremely low income. There's 25 available units for every 100 renters of that income bracket. So this is looking at the state of Florida. I believe the next slide dives into, okay, that next slide is looking at housing cost burdens. So it's a little bit different. This is looking at the cost burden. The cost burden is blue, and severely cost burdened is yellow on these graph charts. And so severely cost burdened means households that are spending more than half of their income rent. And the blue is they're spending more than 30% of their income on housing costs. You know, what is expected is reasonable, or our target area is below 30% of your income should be spent on housing. So here's looking at these people that are paying more than that to live. And so when you look at extremely low income, so these are the people that have the lowest income, you know, 90% are cost burdened. And 82% are severely cost burdened. And then as you get into higher incomes, it gets a little bit better, but it's still, these are startling numbers. And even when you move out to middle income, which is 81 to 100% of area median income in the state of Florida, 47% of households are still cost burdened, meaning paying more than 30% of their income for housing costs, and 7% are severely cost burdened, paying more than 50%. Okay, next slide. Now is the one looking closer to home here in the Tampa, St. Petersburg area. In the Tampa, St. Pete area, the gap report shows that there's 21 affordable and available rental units per 100 for extremely low income housing, so that's actually lower than the state average that we saw in the previous slide. We are the 8th most severe metro area in the US. And 91% also higher than the slide we just saw for the state of extremely low income households with cost burden, and 83% of severely cost burden. So the Tampa and St. Petersburg Clearwater area is in a worse position than the state is an average or a whole. So we're going to dive a little bit into the point in time itself, which we conducted just this past. We conducted it again this past January, but just a reminder, we're not looking at 2024 data yet. That will come in time. That data is being scrubbed and analyzed and all kinds of fun stuff right now. What we're looking at here is the January of 2023, and the point in time at that point showed that there was 2,144 people experiencing homelessness. Of those, 646 were unsheltered, meaning they were not in our sheltered system that night. They were living on the streets or in places not meant for human habitation. And there were 1,498 people in sheltered situations. Now, in comparison to that, or, if we want to look at what are our resources, what beds do we have available to us at that time, there was 1,986 sheltered beds in Pinellas County, which includes our emergency shelters, transitional housing, and safe havens. So as you can kind of see from the numbers, the number of people homeless at any given time exceeds the number of available beds. And then we're also taking a look at our coordinated entry system as well, and comparing that. What do our wait lists look like for unsheltered individuals, families, veterans that are waiting for either rapid housing or permanent supportive housing? And this is referrals based as of April 1st. That's the 2024, right? There are currently 53 families on the wait list, 207 individuals, and 39 veterans waiting for housing. Now, of course, these numbers aren't completely inclusive of every single wait list. We've kind of put a note here that there are some wait lists that may not be reflected in these particular numbers, that people are actually on the wait list for other things that aren't reflected here. But we're pretty common. Okay, so now we're gonna talk about some legislation recently going on. Daisy's going to lead us in this conversation. But before I guess we get into that, are there any questions on the AR, the annual homeless assessment report, or the gap analysis? Yes.
Just a quick question on why right for this. Back. So the difference between the 1,498 people who are experiencing sheltered homelessness and the number of sheltered beds, what are some, do we have an idea, I assume, of what are some of our most common barriers, like that's still a, 500 bed difference? That are open in theory.
We're not open, I mean, so we have more people that are experiencing homelessness than we have beds.
Right, but there's only 1,400, maybe I'm reading wrong, only 100,498 were experiencing shelter homelessness. We have 1,986 shelter.
That's showing that there's a capacity.
Yeah.
I was just curious if you have any insights into kind of like what are barriers potentially,
I think part of it is we don't have enough family shelters. Families can't go into it. We think we don't have family shelters at all. And then there are people that don't want to go into, a safe harbor or something like that. They might have animals, they might have medical needs. So if somebody gets discharged, is, not ambulatory or has stitches or something, they can go to safe harbor.
And Kathleen, I can also say that we do know that there are some places where there are beds, but maybe there's not supportive funding. to pay for the staffing that would need to be added. So, you know, it's similar to any place else when you have more people come in, you need more staff to support.
Yeah, so basically we, on the 1986, we put like, I think a physical capacity.
Okay,
As opposed to a logistical capacity,
realistic at any one point.
yeah.
Okay, thank you.
Oh, I had a question. So for the 500 people that could not get assistance, how do you help them get assistance?
The 500 people, which
You
500,
said you had 2,144 people experiencing homelessness, but you were only able to help 1,498 people shelter homelessness. I would
No.
like to know how you.
no, the 2,140 is at a point in time, is at a given time. So where did you sleep last night? So every one of these numbers were asked the question, where did you sleep last night? And there were 2,144 people total that said last night, I was either in a shelter or I was on the streets or in a place not meant for human habitation. So 1,498 of the 2,148 people were in shelters. So they spent the night in shelter, whereas 646 people were people that we talked to that said, last night I slept in the park, I slept in my car, or I slept in one of these kinds of things. So this particular side doesn't talk about who we helped. It talks about at any given moment, at that night, how many were homeless.
And also, how are you going to help the homeless with the new law that the governor has passed?
That's the next slide. It's a great segue into that. So thank you for that segue.
Yeah, so, hello, everybody. My name is Daisy Correa, and I'm the new CEO for HLA, Homeless Leadership Alliance. And it's a good question. So we've been examining and reviewing a lot of the legislation, and just to kind of give you an overview of the national legislation, what's happening right now, there is a Supreme Court in the of the United States that they will hear Johnson versus Grant Pass, and that's Grant Pass, Oregon. That's going to happen on April 22nd. And this case is pretty much reviewing whether or not the cities have the right to punish or criminalize homeless. So what this essentially is going to decide is whether or not, if it passes, then are they able to criminalize the homeless population? Even though they do not have a safe place to sleep, if there is no other shelter or safer options available for them, or is this going to be something where if it doesn't pass because it's a cruel punishment and unusual punishment for our homeless population? So what we're doing with the Homeless Leadership Alliance, we signed up to a public health professional and organizations amicus brief that notates all of the negative impacts of criminalizing homelessness and also what it does to our most vulnerable community members. So this is what we're examining right now, and we're really keeping in touch of what this is going to say to us as a state, and also what we're going to be able to do as a COC in order to address these needs for our community. So how this legislation affects Florida, if you go to the next slide, sorry. Wait, let me go this way. So the Florida Senate Bill 1530 and House Bill 1365 is going to go, was signed into law March 20th. And actually the effective date is no longer going to be October 1. They actually updated that to January 1st of 2025. So that's a change that just recently happened. And what this bill is stating is that communities and counties and municipalities cannot allow sleeping or camping on public property. So what this is stating is that government have to create safe sleeping areas but they have various stipulations that have to go with it. So DCF, so the Department of Children and Families, has to actually certify that that camping ground or area or designated space has security, running water, bathrooms accessible to the neighbors that are going to be there. It has to be alcohol-free, drug-free, and they cannot reside in that same space for longer than 1 year. So there's just a lot of different caveats that are being implemented with this. And it cannot negatively impact the neighbors around there, the community, the property owners that actually live there, and the resident and local businesses in that specific area. And it's not allowing, and it's also not allocating any funds to go with this legislation. So they're asking all of the counties and municipalities to provide this space. However, there is no funding to be able to provide case management services, wraparound services, rapid rehousing services. We have to really look at what we have within our county so that we can provide services to the clients who may potentially be in these areas.
My next question is, how much money is the government giving for the homeless?
With regards to this bill, as of right now, they haven't allocated any funds.
But we went to a meeting, in January where we were told that HUD had provided $9 million for the homeless in Tampa Bay. So many of us nonprofits are curious, why haven't any of those funds come to the nonprofits that are out there providing food, clean clothes, personal hygiene, asking vendors like Medicaid Medical to come out and do testing, aid bus. There's many organizations that have been doing the homeless, helping the homeless for over 20 years, and they have never received any funding to help keep their organization going. Everything that we have comes out of our pocket.
That shows on record.
The $9 million that's references the continuing ongoing need that continues happening. Pay for the services already existing in the system. That's not new $9 million, that's renewal money that pays for all the services that we currently have in the system. All the permanent supportive housing, all the rapid rehousing, all the, vouchers, all of it.
Things Mike spoke about, right?
Yeah.
And of course, I'm just looking at the legislation. Seems one provision there is, in my mind, it's problematic. It says, will not negatively impact property values, and what does that really mean? For me, it might mean, depending on my value, just the sight of a homeless person is gonna impact my property value, so, I'm really troubled by that.
Right, and the other thing too, that the legislation was saying that it may allow Pinellas residents and business owners to actually sue counties and municipalities because you're not compliant with the new bill. So it makes it even difficult for the providers that are already providing this assistance, and also the cities and counties that are already providing shelter options, to be able to provide additional shelter options. And if they can't do that, now they have the ability or to get sued from different places and entities. So that just brings another stressor on some of our community as well.
I also like to know how many nonprofits do this committee help?
So there are dozens of member organizations who are part of the continuum of care. There are a lot of different ways that continuum of care member organizations benefit from membership. We'll go through a little bit of that later. I think one of the questions you were asking about funding is specific to HUD's notice of funding opportunity for COC programs. And that is funding that goes towards permanent supportive housing programs. We'll talk a little bit more about that later as well, but that goes towards permanent supportive housing programs, rapid rehousing programs, and things like that. Other ways that organizations can work with the COC include resource sharing, volunteer sharing, information sharing, the homeless management information system, which is a shared database and whatnot, but we'll go through a little bit more of that when we get into the COC 101 stuff as well. Good questions.
I got lots of them.
People come in, and they'll have some answers
If,
today.
if you were to, like, if you were to come to a providers council meeting, you would meet, a lot of the representatives of nonprofits.
So you have to be on that meeting?
Huh? May 2nd, yes, and it's at Habitat for Humanity. And all of our meetings are on the, website for the Homeless Leadership Alliance, so you can always go to their website and see any of our meetings and, their dates and times, but like I run a nonprofit and there's several here in the room with me, so there's many nonprofits that are supported by, HUD's money that operate these programs.
How many homeless people have y'all, assisted in housing? To the point that we are a world that we don't think about money. Most of the homeless people that we serve don't have two dimes to rub together, so how are you gonna say you're gonna fix it? Affordable housing is not for homeless. Because we don't have income. I think that's the biggest challenge here is that we have resources that can help people work a program, but we don't have an exit ramp to get them off into stable housing because we don't have enough stable housing in the county. We just don't for rent control, any of that. And one data point that I was made aware of in January when Clearwater underwent a major housing study about what our housing needs were and the gap, and they had a comparative with the county. And one thing that stuck in my head was that Pinellas County has a net gain of 35 people every day. And so when you take into account the births and the deaths and people moving in and people moving out, it was a plus 35 every single day. I don't know where those people are going. I don't know what income bracket they fall in, but just that number that comes into the most densely populated county in the state is a challenge, I think. And it's part of a challenge.
I think the thing to know too is that the HUD money that you're talking about is for people who would be homeless, but they're not because they're in the HUD programs. So all of the people and all the units that Michael mentioned, those are paid for by HUD money,
That 9 million.
but they're not counted as homeless because they're in a HUD program. And if, Boley said, this is how many people we had in our permanent supportive housing. Those are people that are not homeless because they're in permanent supportive housing. So the thing that we're always looking at is, those things are full, but we still have more need. So we're trying to figure out how do we bring more HUD money to the community? Because we know what we have, we know what it's doing, but we also know that it's not yet meeting the need.
And there are some things I think later on in the presentation that help to clarify some of the process a little bit more, like our coordinated entry, how we assess individuals that are homeless and whether they have income, don't have income, whether they have a disability. All those things factor into how we direct them into which program, because if they don't have an income, like you said, how are they gonna, but we do have programs that house people that don't have income. So those things exist. Is it enough for every person? Probably not, but that's the point of doing coordinated entry and assessing people's needs and barriers. So good questions though.
Yeah, and a lot of programs are rapid rehousing programs that are just that, rapid rehousing, so they're short term, probably them are 6-9 months, maybe up to possibly 12 months, but even then, if somebody comes in with 0 income, it takes a while for that client or that person to get job skills training and get acclimated to their environment and settle into their unit and start looking for employment or education, whatever that case is, so that they can become self-sufficient. And sometimes the programs are not long enough, so that can cause a problem too, but there are rapid rehousing programs that can assist with that.
So as a nonprofit, are we able to connect with those programs?
Absolutely. Yes.
Oh, I'm working.
Yeah.
We did have a couple of questions online, but I know we are a little bit behind in our agenda, so if you want to.
I think that they're relevant to the topic we're on right now. I should take them.
Ms. Casey, you had your hand up first?
Yeah, I did just want to speak on something. I did hear a lot of the questions from the members, and I think the way to work at it is I moved here from Ruskin. And at first when I got here, I was homeless for about 4 months. And I didn't know how I was going to utilize the services here that I would need to get, and I was on my own when I moved here. But what I can speak to is that I've worked with several nonprofits for about 6 years, not in leadership positions, but just working and volunteering. And what I can speak to is it's very much a social factor. But I think the one thing that we have to look at is that oftentimes when starting nonprofits, when a lot of people start them, there is this kind of disconnect between the homeless leadership association, seeing all these programs with HUD and how those work, and then applying them to smaller nonprofits. But when you do look at it and you look at it from a systematic point, with consistency, there are these services out there to help you. Just learning how nonprofits work, it makes sense that there are certain social factors that they have to take in, as far as what they're going to allow when serving you. I signed up for several wait lists. It took me until I was homeless for them to actually give me services. So I think some of that is the barrier, is that you have to meet the criteria when you're actually homeless, not when you're on your way to homelessness. That's kind of a barrier. So a lot of the things you can't sign up for and apply for until you are at that point. That's where your smaller nonprofits do come in. So that's where you guys offer a lot of help, the smaller nonprofits. I do understand the frustration because like you're thinking HUD is supposed to help. But that is where creative thinking comes into play. Smaller nonprofits partnering with other smaller nonprofits to get different consumers out there to look at their programs, partnering with the bigger government nonprofits to see what you can do. So I think the through line is that you nonprofits, the smaller nonprofits, help people on their way to like battling homelessness before it gets to that point. So how can we bridge the gap between those? Because everyone's fighting for the same thing. I think. So that was just it.
Thank you for sharing.
Thanks,
Casey.
We also had Miss Teresa Jones, who is one of the COC board members. Teresa, would you like to speak?
Thanks, Victoria. I just wanted to say, I was one that was pretty strong and vocal against the bill that was passed in the legislature and actually spoke before one of the Senate committees before it went to the full vote and signed by our governor. However, I'm starting to think that maybe it will inspire some of the other municipalities within Pinellas County to step up more than they've been doing in the past, and specifically in the area of rapid rehousing. For too long, the city of St. Petersburg and Pinellas County have been the primary investors on the local level to invest in rapid rehousing. We know it's a program that works. Of course, there are some challenges for folks that are housed and don't have incomes, but the wraparound services that go with rapid rehousing helps to find more successes than those that have had those severe challenges and have recidivized. But I hope that the local municipalities will recognize that this is a time for all of us to address homelessness and make investments beyond just what the city of St. Petersburg and Pinellas County does to try and get people housed. Thank you.
Excellent point. Thank you, Teresa. Appreciate that. Okay, we good to move on to the continuum of care? All right, well, I wanted to say, thank you for, if any of you all have participated in the point in time counts that occur in January, that's how we go out and get that data. It's like 7 a.m. to 7 p.m. One day, it's usually Thursday in January, 20 something. And we go out and do a full count as best as we can of unhoused residents in Pinellas County, and appreciate that. We also have a point in time committee. If you'd like to join that and help with that, and then participate in January. That would be great. Also, the point in time count in January of 2024, those numbers should be released in July. So keep heads up about those numbers, and they usually, Tampa Bay Times and others do big reports on those numbers. Okay, so we're going to turn briefly to the continuum of care and how we work up here as a continuum of care board. Continuum just means a progression of things that are usually pretty close together, but when you look at the beginning to the end, they might be very vast, but it's services and interventions along the way of a continuum. So we are a group of dedicated people dedicated to ending homelessness in our community. And COCs are mandated by the U.S. Department of Housing. That's why you saw comparators with Seattle or, Spokane or whatever. And we are this medium urban designation. And then we have goals. So this is what we are designed to do. And hopefully you can see these, but we're going to come back to this slide when we have a little breakout activity that talks about what do we want to see in our COC, and we set some specific, hopefully the executive committee will take your feedback and we will set some annual measurable goals. But this is what we are dedicated and designed to do. Promote a collaborative effort to end homelessness. That's why we have a variety of people that work in this realm. Provide funding that again comes from the federal level so that people experiencing homelessness can access shelter and necessary services quickly, while reducing trauma as much as possible. We want to promote access to and use of community resources. While we're number one in the nation for our size COC of veterans homelessness, veterans also have a number of resources. We want to make sure that they are aware of those resources and we can hold their hand working through those so that they get what they are entitled to. We want to empower members of the community towards self-sufficiency and create and implement long-term plans to end homelessness. That's where it's super challenging, especially in Pinellas County. What is the plan to end it? Our goal is to, reduce it, end it, and make it very short-term and rare. And then we apply the COC through our lead agency, which is the Homeless Leadership Alliance. CEO is Daisy here, and Victoria works for the HLA, so they get paid. And they apply for the annual COC notice, NOFO, Notice of Funding Opportunity, and we'll talk about that a little more later. And that's funding that comes down from the federal government that gets distributed through grants that people apply for. There's a rank and review committee that goes through those applications. So the COC has been around for nearly 40 years, and again, that's our vision, is to make homelessness in Pinellas rare, brief, and a one-time experience. And we have a coordinated entry system to assure that the agencies assess people where they're at, so that those who are in most critical need are served first. So there's an evaluation. And we also follow this housing first format, which you think about, and it's important that we understand this housing first. It means that we don't put any stipulations on people to move them into shelter or housing, like, well, you have to be enrolled in a 12-step program, or you have to be substance free, or this or that. It's housing is first. If you think about Maslow's hierarchy of needs. There are physiological needs, food, clothing, shelter, that you have to have first before you can work on other challenges you may have. And so that's what housing first is. And Victoria, you told me that we've got a housing first, kind of workshop that's being planned. Is it scheduled on the calendar?
I am in the process of finding the paperwork, but tentatively there will be a Housing First Academy training virtually on Monday, June 24th.
Okay, so if you want to learn more about that, and there is some, there's some chatter out in the realm of this about, is housing first the best way to go? So it's good to get yourself educated about it. I feel it is a good way to go. I think, again, that whole Maslow's hierarchy of needs, but, some people think you need to put stipulations on it first. So it's something to be aware of. Housing First also values client choice, which is to make sure that it's a good fit for a person who's unhoused as we find housing for them, in order to ensure their long-term success. All right, we're pretty good. All right, our COC membership, is made up of members who share the goal of ending homelessness in Pinellas County. Our members include people with a lived experience of homelessness, who have been homeless. It serve on a certain board, there's a number like 7 years, but anyone with lived experience can be part of our lived experience advisory committee, LEAP committee. We also have concerned neighbors, local residents, local businesses, faith leaders and organizations. To me, that's one of my goals as chair, is to get more faith-based leaders involved in the COC. I think we need to think creatively and outside of the box about how we're going to engage more community partners. We also have county municipal government officials and entities, and then businesses. So we're all working towards that goal of making homelessness rare, brief, and one time. And so our COC members are elected and serve on COC leadership. They share resources and information. So this is why you want to be hopefully part of our COC. You have access to an expanded pool of volunteers. You can attend networking and training sessions, receive funding and advocacy alerts, and serve on critical COC boards, councils, and committees. So we have a number of committees where if you're a provider, or you're a person with lived experience, or you're a data geek person, where you are really interested in point in time count, we're going to go through a number of these committees. This is where your voice really carries a lot of weight in the conversation about what we're going to do as providers or funders. And we're going to go through some of these committees. So we have I'm looking at my notes here, and then I have to pull my glasses up to look ahead. So we have the board of directors, and this makes policy. This group of a large number of people, you'll see a slide here with a whole bunch of us on there, makes policy decisions on behalf of the COC by evaluating needs. That's where the data comes in. HMIS data, health management information system data, as well as point in time data, implement strategic responses, and then work towards measurable results and report back out on measurable results. Members include elected and appointed leaders. We meet in person every other month. If you'd like to learn more about it, you can go to the website there or email Victoria Couch. And there's the whole list. And so, you've got representative from the public defender's office, the sheriff's office, the Pinellas County School Board, a number of municipalities in the county, people with lived experience. We have faith-based organizations, healthcare, the Juvenile Welfare Board, at-large members, a business representative, a veteran or veterans organization, workforce development person, hospital, all sorts of a variety of people that are part of this board of directors. It's a pretty large group, but a ton of expertise in the room. And then we have the executive committee, which supervises the affairs of the COC's board. And that's many of us up here. So Kevin is part of it. I am, Commissioner Sanders is. We have April Lott, who's the director of Directions for Living, as well as Sean King, who's with Habitat for Humanity, and he's the past chair of the COC. We're also looking for funders, a representative for Funders Council that would serve on an executive committee, and that committee, council is without a chair right now. The Funders Council is really important. So these are entities that provide funding for our homeless prevention and reduction services. And so they advise the COC on funding of homeless and at-risk services, coordinate with local and community-wide planning. They meet in person twice, and they hold 4 joint meetings with the Providers Council. It's really important for that Providers Council and Funders Council to meet together, because these are the ones that providers are on doing all the face-to-face groundwork, and the funders are those Juvenile Welfare Board, St. Pete, Clearwater, the county, and Pinellas Park, right, is an entitlement. They provide funding, and then the providers let them know where the most need is. And I think part of what Teresa Jones mentioned about maybe the good in the legislation is, you know, Pinellas County has 24 municipalities. And what do we have? 3 or 4 entitlement ones that put money into the COC HLA, and 20 of them don't. And so we need to put some pressure on those other municipalities to start, you know, contributing, which I think is interesting. Okay. Funders Council, and the Funders Council, again, Juvenile Welfare Board, all those governmental entities, we need a chair for that. So if anyone here is involved in funders organizations, please engage with that committee, that Funders Council, and lend your voice there. The Providers Council is super important, and that's where those of you who are here looking into the faces of those facing homelessness, struggling with homelessness and wanting to prevent it. And any of those social services for mental health, trauma care, domestic violence, all that. You are providers, and your voice to me is most important, because you know the day stories. And that's what, you know, this council lets us know the true situation that we're dealing with and where the most need is, and maybe some creative ways to handle the challenges we face. So again, and then we have the advocacy committee. It's currently being formed. If you're interested in advocacy about working with state legislators, local electeds about legislation, or advocating for funding, budget allocations, let us know. We just have kind of a capacity. There are a lot of people that are stretched at capacity as far as finding enough people to somebody to lead this, and a meaningful number of people on that committee. But it's important. And this recent legislation, while it's good, it's been delayed to January, it's out there. And, you know, as of now, like you said, it's not been funded. Hopefully when the governor signs the budget early this, you know, June, whenever he does that, there's some line item for that, but it's not there now. So we will see. The next committee is Data System and Performance Committee. It meets on the 3rd Thursday of each month to coordinate data from Pinellas Homeless Management Information System, HMIS, which we'll talk about a little bit later. And this, you know, really analyzes all the input data about, you know, who showed up where, what were their issues, what are their needs, and we track that data. And that committee is chaired by Sam Picard, who's here. And so we need to be data driven, the best that we can. DEI is Diversity, Equity, and Inclusion Committee. I'm happy to say we do say Diversity, Equity, and Inclusion with the COC. HUD awards points based on our addressing diversity, equity, and inclusion needs. And this has a new chair that's been appointed. Her name is Susie Patterson, Dr. Susie Patterson, who is leading this committee. So if you're interested in this one, again, there's an email there. You can always reach out to Victoria, who can direct you. She's the one who knows it all the web of interactions. The Lived Experience Advisory Committee is exciting. Again, HUD looks favorably. This, first of all, it's good practice, not about you, without you at the table. And so this is a Lived Experience Advisory Committee that people who meet includes individuals who have a personal experience with homelessness. They meet in person monthly, and they just elected a chair and vice chair. Right? Do I have their names. It's Michael and
Wayne.
Pardon?
Michael and Wayne were just elected as co-chairs of the Lived Experience Advisory Committee, which started meeting last June. It's already chartered. It's very exciting. And then Pat, who is actually online with us right now, was elected as secretary in that committee as well.
Fantastic. So we're excited about that. And again, you can attend any of these committee meetings. You don't have to be part of it. You can just, if you're curious, if you want to see if it's a good fit, you can attend these meetings as well. The Point in Time Planning Committee is headed up by Victoria, right? And though the event is one day in January, it takes a lot of pre-planning and organization. So there's a big buildup, and she's always in need of people that want to help coordinate it. Because again, we count throughout the whole room. It's a huge undertaking, but a lot of municipalities will allow their employees to help that day, and a lot of nonprofit people, volunteers, come out and help that day as well. All right, so membership. There's a QR code. You can go to pinellashomelessness.org if you'd like to join. And we listened to feedback from one of our last, I don't think it was the immediate last September general membership meeting about the cost of joining. And so we listened to you, and we reduced the cost of becoming a member, especially for nonprofits. There's a sliding scale depending on how many employees you have. And so, you know, the membership rate is right there. I'm gonna need to put it this way. But anyone working or living in Pinellas can join and be part of the COC. You won't necessarily get a vote, but you can join. If you're someone who's under 24, you get to vote and join for free. We need younger people. We need people aging out of foster care. We just teenagers who are in a family that might be unhoused or at risk of being unhoused. We need young adults as part of it. A community advocate, $20, anyone working or living in Pinellas. And then people with lived experience, certainly they don't have a cost and they need a vote. Faith-based is $150. And I believe, does that have a sliding scale as well? Hey, Victoria, sliding scale of faith-based?
For all organizational members, and then for the community advocate, scholarships are available as well.
Yeah, so if you can't afford, ask and we can get funding for you to join and be a member and a voting member. All right. Oh, and lastly, I wanted to share with you. So if you haven't joined or renewed, please do so today, or in the next few days. Please do that. And anyone who joins or renews their membership before May 30th will receive a new COC Ending Homelessness Together decal. Woo-hoo. So if you want to put it on, your computer laptop case or your water bottle or your car. It's just a way to try to get our name out there. And we do have now a separate website for COC and then one for the HLA, our lead agency. So again, COC is all volunteer membership. We do have stipulations that we have to have representation again from the sheriff's department, public defenders, entitlement communities, all those, but they're not paid. But we do have a lead agency who does a lot of work, and that's their profession, and they get paid as they should. It's certainly not, astronomical for the work they do. But it's the HLA, Homeless Leadership Alliance, is our lead agency. And we have our new director, CEO, is Daisy Correa, and she's going to take it from here and tell us a little bit more about the HLA.
Thank you, Kathleen. So I will try to go quickly. I know you've already heard a lot about what we're doing and what HLA does is leadership. So we do have a HLA board of directors outside of the COC, and our board of directors, some of our representatives are here on with us today. And this is kind of just a list. We have people from the government, we have treasurers, we have directors, faith-based. So we have a lot of different members who are joining our HLA board who provide us with direction so that we can make better decisions moving forward. Next slide, please. So what does the HLA do? So we are the lead agency. We are a collaborative applicant. What does that mean, right? So we have a HUD NOFO, Notice of Funding Opportunities for the COC for the Continuum of Care, Pinellas County, and HLA administers that application. We gather all of the applicants together and we submit one full application for the county so that we can review what the needs are, what the gaps are, and then we can get that funding to distribute out to the providers within our COC. Sorry, went really quickly. So we provide, so with that application, it provides permanent supportive housing, rapid rehousing, as I mentioned earlier, transitional housing, supportive services, planning dollars with the HMIS system, which is our system where we house all of our information for our clients, and we can get that data easily pulled so that we can see the numbers of housed and unhoused clients and how quickly our clients are moving from being homeless to housed within our community. Within Pinellas County, we were awarded in 2023 a little bit over $6.1 million for the county to continue these services, like permanent supportive housing, rapid rehousing, and other supportive services for the county.
Anybody wanting to see a complete list of awards, you can scan that QR code or go to the HLA's website.
Yes, and it specifically states who received, what providers received the services and what kind of services they're providing to our clients. So as the lead agency, as I mentioned, we have HMIS, which is Homeless Management Information System, and that is actually a kind of like a warehouse of data information that we have for all of our clients that are coming into our county. How do we best serve them? How do we track our housing initiatives? Do we have enough shelters? So this is all the data that we can grab in order to provide over to HUD. And okay. So the dashboard, you can actually see that information on that QR code, and it really does break down the data and the information for you. You can drill down to the very specific items that you're looking for or data that you're looking for in order to kind of see where we're actually gathering from that information system. And this is why it's really important for our providers to update this information, because this is how we inform the county of any gaps that we may have, or maybe providers that we don't know about. They're giving a service, we can bring those providers into our COC and explore some of those services as well for our neighbors and our clients. So as a lead agency, we have a memorandum of understanding with our continuum of care, and we are registered 501c3. we have a lot of different meetings and supports that so we can ensure that we're compliant with our COC funding. So there's a lot of data reviewing, a lot of monitoring that we have to do in order for us to be compliant with what HUD regulates us to do. The other item too that we oversee as an agency is what's called coordinated entry. So coordinated entry is standard access assessments and referral processes for our clients that are entering into the system. And it's designated to prioritize any clients and to provide the services for the clients that are needing housing services or shelter services. And it kind of defeats the first come, first serve idea. We want to make sure that we prioritize our clients and that the clients who are most need actually go through this prioritization system in order to get the services quickly. And we do also have 211 and outreach that are access points to come into coordinated entry as well. So what we also provide some direct services, which is not always what COCs do, but we do have that in HLA. We do provide housing navigation services, rapid response community navigation, rapid response for prevention and diversion. So we try to have a conversation with the client and possibly divert the client from coming into the system. If there are other options that we can provide, we have funding for that can possibly assist the client. If it's just one payment of rent that they need to get back on their feet, those are services that we provide as well, and also give that information to the client. We also do coordinated entry for our veteran clients as well. We work very closely with our veteran provider, Cities of Fall Cares. We also have a workforce development team. So we do have clients that come in through our rapid response and diversion program, and they get assessed and assigned to a workforce development that will help them get employment or job skills training as they need. And this is the link to the request form for HLA and the QR code as well. I'm sorry, I went really quickly. If you have any questions, you can always feel free to reach out to us and we can answer the questions for you.
I do have a question.
Yes.
How many people do you shelter in your homeless shelter, and how many days that shelter is open? Because I've been told it's only open through a hurricane or cold weather. It's the only time the shelters are open for homeless or anyone in need.
So the Homeless Leadership Alliance does not have or operate shelters. We work with a lot of shelter partners, but we do not have any shelters ourselves that we manage. We do work with the county on emergency management. So when hurricanes come out, we help push out a lot of that information and help make sure that folks know where to go. And we do manage the cold night shelter program, which opens November 15th through March 15th. And those shelters activate when the feels like temperature is 40 degrees or colder overnight.
So essentially HLA coordinates all of that. We don't actually have the departments that we don't have the shelters ourselves physically. We just coordinate the efforts to get clients into shelter.
And we have a little bit of a unique situation in Pinellas in that Safe Harbor is not categorized as a shelter, it's jail diversion. And so that's where a lot of single individuals go, adult individuals go, and it's really not a shelter.
Do you have any list that we can look into, because we deal with a lot of homeless and they ask us, hey, where can we go? And we like to provide them with some answers, but we don't really have them, because we're like, well, we don't know where you can go, you know?
Well, they can go to Safe Harbor, they can walk into Safe Harbor.
The yellow booklet is the resource guide that we create and distribute. So I would encourage everybody to use these. We also have this online. There's a digital interactive guide. So if you, for instance, went to emergency shelter, you could read about Safe Harbor and then click on their website. And these are front ending.
But Victoria, this in response to what he said, isn't it other than Safe Harbor and Pinellas, aren't there civil shelters, we have to follow one deal?
So that is part of the coordinated entry system. That's part of making sure, that there is equal access to services for the folks with we say high security, that's just the fancy way of saying great need. So we do try to make sure that everybody's going through the same kind of front door. That's what coordinated entry is. It's trying to make sure that everybody's going through the same door so that there is equitable access to service. Great question. Point of clarification.
Well, and I'll make a clarification, because Kevin pointed it out about our numbers. So, yeah, is Safe Harbor a shelter or is it jail diversion? It's a little bit of both, but I think in those numbers that we had up there, your point was, it was counted, that's where people were that night before. But as far as it.
Yeah, we're trying to get better clarity around that.
Yeah.
Yeah. Because sometimes it's used as a shelter and sometimes it's not, it's used as a diversion.
They are included in the point in time, so.
Yeah, that 1498 number that we reported of experiencing sheltered homelessness, that includes Safe Harbor
And
beds.
that's the biggest.
And the 1,986 shelter beds in Pinellas includes Safe Harbor beds. So.
We have some internal discussions with leadership on the executive committee.
And the thing is if it, even if it is used as a jail diversion strategy, sometimes those people are also still homeless. It's just that we don't really didn't necessarily at that moment have a way to verify.
What does that mean to jail diversion?
It basically means that if someone is, maybe involved in a
Intoxication.
petty crime, it's typically public intoxication or trespassing. In those situations, if then someone says, well, I don't have anywhere to go, or they can't communicate with law enforcement because of their inebriation, then law enforcement will say, I either take you to jail or you go here to Safe Harbor. And so most people will choose Safe Harbor because it's less intrusive than jail.
What programs are y'all coming up so you can have more shelter? Because only thing you're gonna end homelessness or even put a damper in if you actually have more places where they can go to recuperate so they can get back into the main world and then get one of your affordable houses so then they're no longer homeless. I mean, our problem that we deal with a lot of times, is they can't even take a shower because they have nowhere to take a shower. So how can you walk into the establishment smelling and ask for a job?
And I think you make a good point, and that's where that legislation that I think Teresa Jones mentioned is like, well, maybe we're starting to feel better about this because it requires, you to have adequate case management and cleanliness and be able to have hygiene and all that, and.
With the high rate of snowbirds coming in from north for the hot weather, it's no way. I'm sorry, we're dealing with them on a public basis. Like we are at 365 because this is our heart, this is a dream. I mean, I closed down a few of my companies just to help her because this is what we love to do, it's our passion. So with them coming in at a high rate, like we meet 20 to 30 new people a day. And they from all the way from New York to Detroit, anywhere the cold weather is pushing them to the warmer climate where they can sleep and rest. It's through the roof. I'm just.
Well, I think that maybe we can transition that into our activity. Oh, a couple of questions, okay.
Yeah, if you don't mind, Mr. Gelazzo, serves as one of the COC board members. He also serves as a service expert on the Providers Council. And Michael, do you have something you wanted to say?
Yeah, can you guys hear me okay?
Yeah.
I think that it's very complicated as it was pointed out when you described Pinellas Safe Harbor, because it originally arose, when we had the tent city stuff and the slashing of tents in St. Petersburg now about 15 years ago. And it does serve as jail diversion, but then also does act like shelter with people, because there is case management and there is, there's not a specific limit to the length of stay. And then we try to find, I think that the staff there then works to try to find permanent housing. So it does really act like shelter, but it does have the jail diversion component. I just think it's always important to distinguish that.
Okay, thank you very much. And Casey, do you want to talk again?
You're muted. I think you're muted, Casey.
Oh, yes. I just had a question. So when you guys are unable to provide the people with services, do you outsource to different places? Or do you give to them the county-wide resource manual guide? I'm not sure. It so the resource manual guide has everything in a PDF from so for Pinellas County. And this is the only county, as far as I'm aware of, that I know that does this. Just the outline of our county. I don't think we talk about enough, like the resources. If you formulate like a plan, it is helpful. So there's a Pinellas County resource guide, and it goes by food, housing, all kinds of different things in there. And it's for our counties, and it goes by zip codes and different places in Pinellas County. Do you give people that?
Yes.
Yes, we do. We have it here tonight, but we're handing it out, but yes. Most providers, I think, have access to that and have it at their facilities.
And you can also website for HLA, we do have the QR code and then the website as well. It lists all of the providers and resources there.
Awesome. Yeah, because I find that when I've like dealt with a new clientele or something like that, I find that most of the time here people don't know what the resources are or any of the any services. So just starting there and giving them the resource manual on their own kind of helps them to start and be more self-sufficient that way.
Thank you. I think that's a great one. Thank you. Was there another comment before we go into?
No, I think that's a pretty good segue.
Great. Thanks. I think if you could flip back to slide 24, just to have it up, I was thinking.
Yeah.
But Victoria has designed a brief activity to get some feedback from you all about what you want to see from the COC. You want to go ahead and take it?
Yeah, sure. So we're a little bit short on time tonight, but I was hoping to get a little bit of feedback from everybody. I know we've talked a lot about in boards and committees, and I've sat at my desk a lot and thought about what folks might want to see out of membership, might want to see the COC engage in. But I'm not everybody, and please don't tell my husband I said this, I don't know everything. So I would like your feedback. Folks online, I would like your feedback as well. If we could please, it is 7:13 now, so we're a little bit tight on time. I don't know if we can do breakout groups. But if we could please, if you could sit down, if you want to talk to your neighbor, please do. Just take 5 minutes to think about what you would like to see from the COC. Be it activities the COC engages in or benefits that you would like to get out of your membership. Please go ahead and take 5 minutes. Well, so it's okay, because they're having a hard time hearing online, there are multiple people talking, so sorry. So if we could please go until it's 7:13 right now, so until 7:19 for the sake of getting everything together. And if you could write down 3 things, if you can come up with anything separately, you'd like to see from membership or from the COC, I would really appreciate it. And then I'm gonna ask a few brave folks to share one of the things that they would like to see. So let's go ahead, if you want to work with a neighbor, you are welcome to, but you don't have to. You have 5 minutes, I will start a timer, I will pull up that slide that Chair Beckman has requested. And let's think and talk about what we would like to see from membership. Online, I want to hear what you want to see as well. No, that is the fastest 5 minutes, and I might be the loudest person you have met this week. If anybody needs me to come in and get a room full of children to pay attention to them, I'm there. Okay, so I would love to hear from some folks. I did get a couple of volunteers online to send me some things, so I do have some things I can read off. But I would love to see if anybody is brave enough to share one or two suggestions or hopes or goals for the future with us.
Okay. So two things that we talked about over here, as kind of like important areas that maybe things to work on or, go towards in the future. So one was just around the like legislative, information. So for lots of people, we catch pieces of things going on. Sometimes we'll get it at the end, sometimes you get in the middle and you lose track and you have no idea where things went. And so perhaps a little more, frequent, I don't know, I know you all talk about the advocacy groups, that may be part of it, right? But more frequent dissemination of that information about like what is going on. These are the bills, this is where it's hitting, this is what's to watch, and here's what you can do if you want to do something about it. We didn't talk about this part, but I also wrote down just, having that group be kind of frequently interactive with the local and state legislators, to inform that, so. Like I also been, as a member of the state chamber of commerce, so they have kind of frequent legislative interaction, that's pretty useful. And then the second one, we were just talking about, what is the kind of efficiency and effectiveness of the current coordinated incident process? And whether something that we couldn't do is actually put together kind of a like research group to understand how that's impacting all the individual providers and the clients right now. If there are any ways that we can make that more efficient, more effective, more accessible, or just improve all kind of the groundwork for what's been laid thus far.
Awesome. Thank you very much. Those are really awesome and well thought out suggestions. Thank you very, very much for sharing. I know that that's kind of a hard one to follow, but would anybody like to? All right, I'm gonna read one from online then. Or online, please feel free to raise your hand if you want to. But more disability awareness training, mental health awareness meetings, regular outreach events with different members of the COC where members of the homeless community could come. More housing opportunities, partner with smaller nonprofits to host a get-together. Arts initiatives for ending homelessness. Oh, good, and somebody online wants to speak. Please come off mute so that everybody can stop listening to me.
Yeah, my name is Andy Francis. I do outreach for the Recovery Epicenter Foundation in Clearwater, specifically with the unsheltered community. And for the unsheltered community, I would like to see sort of a regular outreach event hosted and administered by the HLA, where different members of the COC could all come to a common area, maybe around like a St. Vincent de Paul or a Shepherd Center, where members of the unsheltered community already tend to be. And then different providers could be available to help them all in one space with their particular needs. So if somebody was to have kind of a specific need that they were having trouble getting addressed, that provider could be there. If they have a whole host of needs, they could knock out a bunch of things, hopefully, in one outreach event. It would be a good opportunity, I think, for COC members to network and kind of learn about what other partner organizations are doing. And I think it would really be helpful for people who are not in programs, are unsheltered, people like we talked about earlier who aren't in programs because they're not yet homeless, but on their way to homelessness. And obviously for people who are transportation challenged, to have it all in one area, I think could be useful.
Thank you very much for sharing, Andy. And events like that are definitely impactful. Our partners at the VA just held the stand down for homeless veterans, which was very similar to what you're talking about. And I know that that was a really great and appreciated thing for the community. So thank you for the suggestion for the COC as well. We really appreciate that. Is there anybody else who would like to share? I'll do another one from online, a DEI initiative to hire more people that have lived experience. There's actually legislation to make it easier for folks who've lived experience of homelessness to work in homeless services. I'm very excited about that. So great suggestion, Casey, and way to be right in line with legislation. That's awesome. Anybody else who would like to share? Okay, so for anybody who doesn't know me well, you will hear me say this often. Nothing is speak now or forever hold your peace. I sincerely welcome feedback, suggestions, and volunteers. In case anybody would like to host one of these awesome events or projects that we've talked about, I would love to work with you on it. Please feel free to reach out to me if you have other suggestions. Everybody got here, so I think you have my email, but it's bkelly@hla.org, just in case. And if it is okay with you, if I could, before we leave here today, just collect whatever recommendations you have so that we can, so that I can make a note of them. I would really appreciate it. And with that in mind, I'm going to ask, is there anybody? I apologize, I did not do comment cards, so please ignore the comment about the cards. But is there anybody who would like to share something with the group for the good of the group? You do have a minute to do so now. If you have any news, updates, exciting things that you would like folks to know about. All right, well, if you change your mind and you decide that there's something you would like to share, again, please feel free to send that to me. I'm happy to share flyers with our providers and our members. If you are a COC member organization, I love putting your flyers for events and resources up on our social media and whatnot and sharing that with the community. So please send it to me so that I can do that. Folks, come to our social media to see what's going on in the community. So please help me inform folks. And we do have one hand up. Casey, would you like to go ahead?
Yeah, sure. If nobody knows about it, I've worked for the Tampa Lighthouse for the Blind, or there's also the Pinellas Lighthouse for the Blind. Those are two great nonprofits and resources that, if you have visually impaired loved ones, you should check out, and yeah, be aware of.
Thank you so much for sharing, Casey, and for all of your great feedback today. I just want to make sure everybody was aware of future meetings. Our next COC membership meeting is, I'm trying to get that out of the way, but I cannot move it behind that box. It says August 13th. We will be meeting at the Pinellas County Housing Authority, and there will also be an opportunity for a tour to one of their properties while we're there. That is Tuesday, August 13th, same time, also available on Zoom. And then on Tuesday, November 12th, haven't figured out that location yet, but we will be meeting again then. And then also, please don't forget about the COC information sessions. Those are a new thing. We started them in February, and we are inviting COC providers to share resources with the community. Make sure the community knows what resources, programs, initiatives you have, and how they can access them. So if you would like to participate in one of those, please feel free to reach out to me. We have 6 more of them this year, and they are held virtually at the same time. So that information is there also on our website.
And Victoria, aren't those recorded?
They are absolutely.
Because the information sessions have gotten really positive feedback on the resources that are available. For example, our Clearwater Neighborhoods manager attended the one we just had recently where PSTA was there, and she took all that information, was able to disseminate it to the neighborhood leaders, just just to share about those resources, especially for our elderly.
Yeah.
So we do have a number of resources that people are just, unaware.
Yep, so far we've done, healthcare resources, legal resources, transportation resources, educational resources, and workforce resources. So, those are available on our YouTube channel. And Ms. Casey?
Oh, I was just gonna ask, where would the PSTA be located? The PSTA informational resource video be located?
Those
Is it
are,
on?
those are on our website, and I tell you what, as a follow-up to this meeting, I will send out the video recordings and materials from our first couple of information sessions as well, just so nobody has to go.
Well, thank you. Victoria, you did a phenomenal job organizing the meeting. You really did, you know, the PowerPoint and the help and the snacks and things up there, we really appreciate it. So thank you for attending. If you're not a member, please join and be a member. We need you at the table. We need diverse voices. We value that, and diverse partners throughout the entire county. We really do need that. It's all hands on deck right now.
Yeah.
I mean, it is.
Enjoy while you can get a
Yeah,
sticker.
it's a cool sticker. But thank you so much. Hopefully we'll see you at a committee meeting. Just drop in, see if it's for you. And we'll see you at the next general membership meeting. Any last words on the thing?
No, thank you, everybody.
Thank you.